My people, story. So, as promised, I said I was going to be sharing some stories here on the podcast, which I think will be helpful for us to see and learn from people's struggles and find ways that we can also improve our health. Today's story actually touched me special. And I'm hoping that it's going to speak to somebody that is listening today and help them to go through something that they're going through. So recently, I've just heard from a very strong, hardworking Nigerian woman. She's a mother of twin teenage boys. She's married and she has given me permission to share her story here today. And I've promised her anonymity, so let's just call her Ada. Ada moved to Canada with her husband in 2022. And just like many of us, she was full of hope, plans for a better life. But a year before she traveled, she had gone to see a doctor in Nigeria, and the doctor told her she was pre-diabetic. She took it very seriously because of her family history. Her mom was also diabetic, and she started changing her lifestyle, changing her diet, working more, doing her best. But of course, then immigration happened in 2022, and as you know, it's not just about landing, it's about surviving. And this woman was juggling family life, shift work. She was trying to keep the light on, paying bills, rent, and she was doing 9 shifts. And in a situation like that, as we know, sleep can easily become a luxury, which it did. Eventually, her health started slipping. She didn't notice it at first, until one day when she was doing her second job. After doing like a string of 12-hour nights, she collapsed. She was rushed to the emergency room, and that's when they told her the words that she feared the most. The doctor told her, "Lady, your blood sugar is dangerously high. You now have diabetes, and we need to start you on insulin immediately." She was devastated. And then 2 weeks ago, she messaged me and she was saying, I'll read the text as it is. So she messaged me 2 weeks ago and she was saying, "Please, Dr. Amma, what can I do? All I wanted was a better life for my family, and now I'm scared. My own mother died from diabetes, even when she was much younger. And here I am now, following in the same path. I wish somebody had warned me. I wish somebody had told me to take my health more seriously. Please advise me. What can I do?" Like I said, it was a very emotional one for me because this is a good friend, but I hadn't spoken to her in a while. And of course, immediately I connected with her. I spoke with her, I provided her with some counsel, gave her advice and support. And fortunately today, she's doing much better. But boy, oh boy, isn't that the kind of story that will just make you pause? And I'm sure to somebody else, this story might just be nothing, right? I mean, people are dealing with way worse. But this woman, it took everything out of her. And times like this, it makes me pause, but at the same time, it also reminds me that this is exactly why I'm constantly talking about immigrant health and wellness on this podcast. It's important for us to remember that while we are spending so much time and energy building a life, we forget to build our bodies. But I'm hoping that all that will change, hopefully, as you continue to listen to me, as you continue to tune in and listen to this podcast. I hope that it'll touch you and you'll find ways to improve your life. So hey there, transplants. Welcome back to the podcast. Here is the Immigrant Health and Wellness Tips with Dr. Amma, where we're sharing real-life immigrant stories, we're discussing health tips and wellness wisdom for immigrants as we settle into our new life abroad. I'm your host, Dr. Amma. I'm a family doctor, I'm a lifestyle medicine advocate, and I'm a proud immigrant myself. Now, while today's episode is actually here to acknowledge people like Ada, in their struggles, I also want to use this opportunity to talk to people who are fairly new or like new immigrants, or maybe you've been here for a few years, but you haven't quite gotten around checking in with your health. Look, no judgment, right? This is a judgment-free zone. We're just here to reset, we're here to refresh, and just to remind you that your health actually matters. And as you're building a life, building a country, you're also remembering to build yourself. But before I go any further, let me start by backtracking a little bit for those that are yet to land. So if you're still contemplating or you're still planning your move, I want to just talk to you quickly about the pre-arrival health checklist for you to really consider. First thing you should do is, number one, get a full health checkup before you leave your home country. I'm talking about dental, vision, blood work, the whole shebang. Just get it done. And I say this because healthcare access can take time when you land. depending on the province. So handle any pending or any pressing issues now while you're in your home country. And the next thing is to gather health records. Preferably bring them in both print and digital copies. And I'm talking your medical records, any active prescriptions, vaccination records as well. If you even have lab results, bring them as well. And as a bonus, if you have them written in other languages apart from English or French, you might want to consider translating them for that ease of communication. And the other thing is for you to pack your medications. I'll suggest bringing at least 3 to 6 months worth of any prescription medication, because it might take a while, like I said, before you find a new primary care provider here. There might be a limitation. And remember, if you're traveling with prescriptions, please include a doctor's note for your prescriptions, because since you're crossing international borders, they might ask you for it. And then when you have landed, consider getting insured for the first 3 months, depending on where you are. If you're coming to Canada, in provinces like Ontario, British Columbia, or Quebec, there is a waiting period of approximately 3 months before your government health coverage will kick in. So you'll want a private insurance to bridge that gap. So the next thing is now you've come, you've made it, right? First, you want to take a deep breath. You have made it. So welcome. And I mean it seriously, welcome. You've done something incredibly brave. You've done something bold. You packed up your life, you packed off everything you know, left your comfort zone, and stepped into a new world. I don't care how many people were on that flight, or I don't care what people say or how they try to trivialize it. You were the hero of your own story that day. I remember it like yesterday when I also arrived. I was filled with a cocktail of emotions. I arrived in Canada in 2020 as a single woman, and it was a roller coaster of emotions. But let's get real. When you're moving to a new country, no matter how exciting or thrilling it is, it's very stressful. You probably had to decode a lot of accents, weather changes, culture shock, and lots of weird food labels. And you're doing that in a very short time, sometimes within 1 week. So well done, it's not easy. On the other hand, you should also remember that your health is not going to pause while you're trying to figure out your new life. In fact, I think this will be the perfect time for you to reclaim it and regain control of your health. And that's what I'm trying to share with you today. So just stick around and let me just share those insights with you. After you have arrived, for the first 3 months, you're in somewhere like Canada. You've touched down, you've probably gotten a new SIM card check, you've done a bank account check, you've probably traveled to some hot spots, destination areas in that country or that city, and you've probably registered for a health plan. Let's talk more about that health plan, right? Let me give you some ideas on how to set yourself up for long-term health success. Number one, like I said, if you're in a place like Canada, you want to register for a provincial health insurance plan as soon as possible. Apply for your health card right away. Each province is different. If you're coming to somewhere like Alberta, where many newcomers are landing, you can apply on arrival and you will get it immediately. Meanwhile, some other provinces may take at least 3 months, like places like BC, Ontario, or Quebec. These are places that might take a bit longer. The next thing you must do, number 2, find a family doctor. Consider your family doctor as like your health safety net or like a quarterback, somebody that can coordinate your care, keep your health records, initiate referrals when you need it. And to find them, you can use websites like Medimap if you're anywhere in the country, or specific provincial directories. Like if you're in Alberta, you can use the albertafindadoctor.ca. Please don't wait till you're sick. Don't. Start early, because as you know or may not know, there is a serious physician shortage in Canada. So the earlier you get started, and you can also get connected based on referrals. So just get started. And after you've been successful in finding a family doctor, the next thing we'll talk about is for you to schedule a welcome to Canada health check. Now, this is very, very important, and I can't stress it enough. Even if you're feeling good, even if you're feeling healthy, you're feeling great, book a visit. This is just to establish that connection, establish that care. In that visit, you can go over your blood pressure, go over your blood sugar, go over your blood cholesterol. They can even do a mental health screening and then check on your immunization records for anything that you might need. So that visit is very, very important. For those of you that might live in Canada, you may have heard about the current measles outbreak. And as I make this recording, I know there is a current measles outbreak in Canada. So this is a kind of a time where you want to check in with your immunization records, see if you might need a booster, and then talk to your doctor about getting one. I know some people are confused about how the health system works in Canada. So let me just give you a quick glimpse into the Canadian health system. Just as a general knowledge, it is publicly funded, meaning that basic care is free. But things like dental, vision, and certain medications are not free. You may have to pay out of pocket. You also need to register with a family doctor, meaning that you cannot just walk into any clinic anytime. Although there are certain walk-in clinics, but like I said earlier, there is a shortage, and sometimes you might be waiting for hours. So that's why I recommended registering with a family doctor so that you can get that continuous care. It's important to also note that wait times can be very long for specialists. That's why prevention is your best friend, and you also need that connection with the family doctor to kind of have that thing. I understand there's a shortage, but the earlier you get into looking, the better for you. And then another thing is emergency rooms. These are purely for emergencies out here in Canada. They're not designed for like sore throats or medication refills. Although in specific settings, when we are in dire need, those services may be provided, but that's not why they're there. So you also need a family doctor to kind of help you to bridge that gap, you see? So my fellow transplants, you're settling in, you're trying to make a life for yourself. Remember to try and make your health and your wellness a priority. And I would recommend doing this by developing some key habits. And I'm going to share with you 6 key habits that have been considered to be the pillars of good health. And these are habits that will keep you strong, they'll keep you happy, they'll keep you thriving, especially in your new home. So let's break it down a little bit. The first habit is your sleep. Sleep. I'm always trying to emphasize on sleep because sleep can easily fall off the radar. After that newcomer highs and lows, after the jet lag is over, and after, or maybe you may have not started any shift work, the goal is to aim for 7 to 9 hours of sleep a day. I want you to just have that at the back of your mind that you need to protect your sleep like you are protecting that your visa or that your COPR. It's equally important because optimal sleep is the baseline for good health. The second pillar is nutrition. As a newcomer, it's tempting to start eating like you're still in survival mode, like you're just out of prison, so you're just consuming anything and everything. But I think now is the time for you to build a healthier plate. And a healthy plate generally entails, according to WHO, a healthy plate, try to think of your plates and divide it into 3. It means 50% of that plate has more fruits and veggies, 25% has more of proteins, and the other 25% has more of whole grains. The next pillar I'll talk about is physical activity. You don't need a gym for this. Really, I'm talking just your living room, your bedroom. This can be more than enough space. Just with a little bit of a mat, you can dance, you can walk. And when it's winter time, you can even shovel snow. That counts as good exercise. Just keep moving your body. And 30 minutes a day of that movement is golden. Another significant pillar is stress management. Abroad can be very cold, and I mean this both physically and emotionally. So it's okay to actually feel lonely or overwhelmed. I see a lot of people cry and lament, and I empathize with them, but these feelings are expected. You can start a habit like journaling or some mindfulness apps. Find any creative outlets to just release that energy. Talk to somebody if you have to. I've come to realize in my adulthood that vulnerability is actually strength. So communicate. And that brings me to another pillar, which is social connection. Don't isolate yourself. Join a newcomer group, attend like a faith-based community like church or a mosque, attend community events, local events, volunteer, get into things. Connection will heal. And you've come to a new place, it's okay for you to learn about them, their customs, their traditions, and see ways that you can also add that to your daily lifestyle. And the final pillar that I'll talk about is avoid harmful substances. And by this I mean alcohol, smoking. And yes, I know that cannabis is legal in Canada. However, it still has its health risks. So be cautious when you're using this. And also other things like painkillers or sleeping pills. You also want to minimize the use to a bare minimum. And talk to a doctor if you find that you're struggling in these areas and you're needing more of these things to cope. So talk to your doctor at that point. I want to use this opportunity to call out to everybody to share a story with this community that is growing. If you have a health story as a newcomer or even an experienced person or a health provider, any challenge that you've overcome, something that you're still struggling with, just sending it with me. I would like to really feature your voice, answer your questions and your journey, because your story might actually be the survival guide that somebody else needs. So you can send us a DM either on Instagram at Dr. Amma Speaks. You can send me a message right here and I will connect with you as soon as possible. And I just want to part with some final words. You've already made the boldest move, like I said. You've done something exceedingly brave. You've made that move. So now that you've made it, let's make sure that your health is equally as strong as your courage. You've come, you are building a country, you're building a life, you're helping to do that, but you also deserve to thrive. You deserve to not just survive. So just take this today as a gentle reminder, but a real reminder. Remember that you need to check in. That way you will not check out in the near future. Once again, it's Dr. Amma, and I'm signing out today, but not before telling you, stay connected and stay well. Until next time, bye-bye.